I'm going to talk about intraoperative visualization of urethra using illuminating catheter in laparoscopy-assisted anorexoplasty for imperforated anus. We have no financial relationships to disclose. The use of near-infrared fluorescent imaging with indocyanine green (ICG) has gained popularity in pediatric surgery. Recently, the near-infrared catheter (NIRC) has been used in colorectal and gynecology surgery to avoid damaging the ureter. The NIRC helps visualize the ureter intraoperatively to prevent urethral damage. Dissecting a rectovalvular urethral fistula (RVUF) is one of the most technically challenging aspects of laparoscopy-assisted anorexoplasty (LAARP) for anorectal malformation (ARM). We hereby report an intraoperative visualization technique of the urethra using an illuminating catheter in LAARP for RVUF. A 3 kg town male neonate with ARM was delivered. An invertogram revealed the intermediate type. Transverse colostomy was performed at the left upper abdomen. A RVUF was diagnosed via distal colostogram and voiding cystourethrogram. LAARP was planned at 6 months old. Under general anesthesia, the patient was placed in the rhastotomy position caudally on the operative bed, so that the operator could perform anaplasty at the end of the operation table. Our previously reported standard port placement is shown in the slide. Before starting rectal dissection, a 6 French pigtail type NIRC was inserted through the external opening of the urethra to visualize the urethra during the procedure. While dissecting the deep pelvic space between the posterior wall of the urethra and anterior wall of the rectum, the exact line of the urethra was clearly visualized by overlaying images from the NIRC. Dissection of the RVUF was performed safely using this innovative image-guided technique. There were no intraoperative and postoperative complications. Urethrogram showed no residual fistula, no leakage, and no stenosis. In this technical report, we performed LAARP using an NIRC in the urethra to visualize the ideal urethral dissection line and obtained a successful outcome. Further cases are required to evaluate the lower urinary tract complications after LAARP with NIRC.